Hello, residents, family members, and teammates. It has been an incredible joy to see the Wesleyan community begin to blossom through increased visitations, socializations, trips, and outings. Many of the activities that we previously took for granted and were curtailed throughout the pandemic surge over the past year. Behind the scenes, our Wesleyan teammates have been working diligently to build and define new relationships inside and outside the community as our contractors and vendors' business practices have markedly changed as a result of the healthcare crisis. Difficult though it may be to hear, while we are very much done with COVID-19, it has never relinquished its presence or involvement with us. The Wesleyan was successful at keeping COVID-19 at bay for most of the year, and that was due in large part to all of you and how you cared for your neighbors, your families, and your fellow teammates. Your efforts, the hard work of our teammates, and the guidance that we received from state and federal regulatory guidance greatly diminished our community's exposure to COVID-19, with the exception of an incredible surge that took place throughout the holiday season when we did not yet have a vaccine and families were gathering indoors. While we had many successes adapting to this novel healthcare crisis, we also had a number of opportunities to learn from it. It has been our steadfast prayer that although there continues to be new cases and a new surge has been predicted, the common sense and proactive actions of our Wesleyan family will be mirrored outside of our community and throughout our state. Unfortunately, our county, state, and nation have seen a dramatic increase in new infection rates. Most recently, Williamson County has returned to COVID-19 phase red, denoting uncontrolled spread of the virus. We have been closely monitoring these developments and have adjusted policies, procedures, and practices in small ways to best safeguard all of you, while trying not to roll back any of the reinstituted activities that have been enjoyed over the last several months. We don't know how this virus and its variants will progress or what returning or revised guidance we will receive from the county and state, but we will continue to remain vigilant and with dedicated resources to stay ahead of the information and communicate those updates to you. Remember, we are in a far better situation now than we were last year due to the availability and our provision of the vaccines. We are extremely blessed that we are in the 90th plus percentile of residents vaccinated and that the majority of our teammates are vaccinated as well. We are adding new residents and teammates every day, each to those numbers, each week with our vaccine clinics. We want to be a source of education and support for our entire Wesleyan family to assist in making the most informed decisions you can make in safeguarding those we serve, those with whom we serve, and you. We have already heard concerns and speculation about what will happen with this new surge, the effectiveness of existing vaccinations, whether boosters will be necessary, whether or not there will be a vaccine mandate, and many other yet to be answered questions. I would first urge our residents and teammates to stay connected with our communications. We will be providing updates as we receive them, and any change to Wesleyan policy or practices will come through official announcements and postings, not word of mouth. The complexity of this healthcare issue is challenging enough without having to navigate unfounded rumors. Each of us can play a significant role in helping reduce the anxiety of our community by staying informed and verifying the sources of what we hear. The second request I would make is continuing to use the proven best practices of mask use, hand washing, and appropriate social distancing on and off campus. These practices continue to be urged by health agencies for the vaccinated and unvaccinated alike as simple and effective measures to protect ourselves and one another. The Wesleyan will have modified and/or increased practices for those in our community who are unvaccinated. These practices are recommendations as well from health agencies and state and federal regulatory departments. As a community that provides many different levels of care, please understand that policies may be different from one part of our community to the next. It is important to know the current policies and procedures of the community in which you live or work, while also accommodating the particular practices required at each building. And lastly, I want to say that while this surge causes me concern, it does not cause me fear. The incredible caring, patience, and resilience of our residents, family members, and teammates demonstrated over the past year and a half provides me with confidence that we can face this and any other adversity because of the shared strength of this community and our commitment to caring together. Thank you.